Assalamu alaikum. Hello and welcome back to Health Science, Unit 5, Health Promotion. My name is Mr. Ahmed and I will guiding you through this lesson. So today we'll be covering lesson 5.1, Health Promotion and Health Education. First, let's have a look at the learning outcomes. Before talking about learning outcomes, we have introduction about health promotion and health education. Health promotion enables individuals to have more control over their own health and well-being. Health promotion is usually presented to individual groups or whole population through health education. The way it's delivered can vary from one-to-one session with a doctor or nurse to a larger professionals or publication in the media. Effective health education can prevent disease and increase overall health and well-being. Throughout this unit, you are gonna to explore health promotion and health education and the effect that it can have on reducing disease. You will review existing health education programming within the local community and explore community health within the United Arab Emirates. First, let's have a look at learning outcomes. Learning outcomes. By the end of this lesson, learners will be able to define health promotion and health education. Okay, now let's have a look at the key words that you will learn through this lesson. First, we have educating. Educating meaning to give information and spread knowledge about something. Examples like giving your information about health science and physics and chemistry and et al. Okay. Next, we have health promotion. Health promotion meaning the process of enabling people to increase control over and to improve their health. Second, we have population. Population, which is the number of people who live in a place. Screening, which is doing tests on people's blood, on skin, on brain or urine. Why? To check for sign of disease and illness. Sign, which means can be seen by others, like fever. Clear? Next, we have lifestyle. Lifestyle, which is the way a person lives or a group of people lives, like person who have eating healthy diet or healthy balanced diet or doing exercise is healthy. Clear? Next, we have preventative. Preventative to stop something bad from happening, like stop COVID-19 by vaccinations. Next, we have lifestyle, which is the way person lives or a group of people lives. Next, we have education. Education to give information and spread knowledge about something, like give your information about health science and physics and et al. Next, we have individual. Individual, which is relating just one number of a large group. Mass, a large amount or amount of something like 1 kilo tomato. Okay. Next, we have audience. Audience, which mean a group of people who are informed of something. And finally, we have prevention. Prevention, which is stopping something bad from happening. Now, we are gonna discuss beat the habit. Watch the health promotion videos from the United Arab Emirates Ministry of Health and Prevention that were part of the Beat the Habit campaign. Eat the habit, fight extra sugar, then answer the question on your workbook. Okay, now we are gonna discuss health promotion according to World Health Organization. Health promotion, the World Health Organization defines health promotion as the process of enabling people to increase control over and to improve their health, and its move point a focus on individual behavior towards a wide range of social and environmental intervention. What does this mean? This means health promotion gives people the information and skill to improve or to their own health or to improve our health. Okay, now we have some food like apple. This is healthy, but this is unhealthy. Okay, now you studied health in the previous term. Health is a state of complete physical and mental and social well-being, and not merely the absence of disease or infirmity. Now we studied health promotion. Health promotion, which is the process of enabling people to increase control over and to improve their health. It moves the point of focus on individual behavior towards a wide range of social and environmental intervention. Clear? Now we are gonna discuss what does health promotion look like. Have you ever seen adverts on television or other application that encourage you to eat healthier or do more exercise? Have you ever seen posters or leaflets like the ones below in hospitals, malls, or schools? Have you ever gone to your local hospital or pharmacy and seen notice about screening for things like diabetes or blood pressure check? These are all examples of health promotion. So health promotion is all around you. You may see in the following forms. Health promotion is all around you, like avoid touching your eyes and nose or mouth without wasting your hands. Without washing your hands. Clear? Now, health promotion is all around you. Health promotion, you may see it in the following forms: posters in public and places, like beat the habit, fight extra sugar, leaflets in a doctor's offices, information boards in hospitals, advertisement in pharmacies, radio, and TV advertising. Okay? Also, we have health education. Health, we we studied health. Health is a state of complete physical and social and mental and social well-being, not merely the absence of disease or infirmity. Now we are gonna discuss education. What does education mean? Education, which is to give information and spread knowledge about something, like Mrs. Teach our schools about healthy food. Clear? Health education uses medical science to teach people about health and well-being. Health education aims to health education aims to what? Aims to increases people's knowledge and understanding of health. Now, I want to ask you, all of you, what is the aim of health education? Your answer is health education aims to increase people's knowledge and understanding of health. With this knowledge, they will gain the skills needed to be able to improve their health. You are doing it right now. Uses medical science to educate people about issues related to health and well-being, increases people knowledge of health, and delivered in a school and communities and medical settings. You are doing it right now. Use medical science. Why? To educate people about issues related to health and well-being. Number 2, increases people knowledge of health. Number 3, delivered in schools and communities and medical settings. Now we have a question match of the following sentences. First, we have definition: health promotion and health education. Health promotion is an area of study or a type of advertisement. Excellent. Health promotion is a type of advertisement. Health education. So health education is, yes, an area of study. Clear? Next, we have further information about health promotion and health education. So, aims of health education. The overall aims of health education is to improve the health of the individual as well as their family and friends and community. But there are more aims for health education. Available health services. People need to learn what health services are available to them. Health education teach people what services they will find in their local area. It should also teach people what type of doctor they needed to see, and depending on their injury or illness. For example, advertisement on TV, advertisement on radio, and social media that describe how to properly wash your hands in order to stop spread of COVID-19, or an example of health education. Okay, early diagnosis and treatment. Early diagnosis and treatment. Early diagnosis of a disease is very important. The sooner a disease is diagnosed, the sooner a doctor can give treatment or cure for the disease without causing more damage to the body. Health education teaches people about various illnesses. It's also teach people how disease can be passed from one person to another. People can also learn to notice some of the signs and the symptoms of these illness. Okay, now we have approaches to health education. My question is, what or how many types of approach of health education? Yes, we have 3 approaches to health education. There are three different approaches to health education. These approaches describe how information is given to people in order to educate them. These approaches are: first, yes, individual approaches; second, group approach; third, mass audience approach. We studied in some details. Approaches to health education: individual approach, group approach, mass audience approaches. First, individual approaches, from one-to-one education. And it can be in the form of clinic consultation with a medical professional. It may also be non-medical settings, such as community or center or home setting, like this picture. Group approach, this is when health educator educates as a group of individual, concentrate, group of individual, concentrate individual, one to one, but group approach, group of individual, educate a group of individual. For example, the teacher and your class, the teacher and your class in health science lessons. This may be through lecture or seminars, group health improvement program, discussion, or workshop. This may be in a medical setting, community setting, schools, or workplace. And finally, we have mass audience approach. Use mass media. Why use mass media? To reach a large population group. May be given through radio, television, the internet, newspapers, and magazines, like this picture. Now we have examples. The Ministry of Health Prevention uses the internet and social media to educate resistance across the United Arab Emirates about many health topics. The image below shows an example of how health education is used to teach the population about some of the masks that are available for us. Now we have N95 mask. This mask filters or stop the small contaminated particles from entering the mouth or nasal passage. It provides 95% protection. It is used by medical staff who have direct contact with patients. This kind of mask is disposable. Surgical massage, this mask is effective. Why? This is against the large particle droplets, but doesn't filter very small particles. It is used to by the surgical staff for protection during operation. This kind of mask is disposable. Okay? Which approaches? Identify which approach to health education is being shown in each of the picture below. Yes, what is this? For the three types of approach: individual, group approach, mass audience approach. This is, write your answer in your comment and I respond to you, okay? Second and third, one-to-one, a group of people or individual group, and mass audience approaches. Clear? Now we have examples or some question about approaches to health education. First, we have individual approach. Individual approach, which is when a medical professional teach a group of people, or when the media is used to reach a large amount of people, or one-to-one health education. Yes, you. First, individual approach is yes, one to one health education. Group approaches, which is when the media is used to reach a large amount of people, or when medical professionals teach a group of people. Excellent. When a medical professionals teaches a group of people. Mass audience approach, which is, yes, when the media is used to reach, when the media is used to reach a large amount of people. Okay, what is the difference between health promotion and health education? What is the difference between health promotion and health education? The difference between health promotion and health education, remember, health education is an important part of health promotion. Now, both have, health promotion and health education, the same aims to improve people's health. Health education is an area of study. Health promotion is a type of advancing. Clear? Thank you, all of you.